Hello, this is Dr. Kim Jong-il. Today, we will look at the meaning of the occlusal plane. The occlusal plane means curve of Spee for anteroposterior and curve of Wilson for buccolingual direction. Firstly, the occlusal plane is expressed as the chewing efficiency. For ease of explanation, let's take scissors as an example. We can see that scissors B has better cutting power compared to scissors A. The same is true for oral cavity. Occlusal contact surfaces like B increases mastication efficiency. However, the mastication efficiency like A is slightly lower than that of B. The second is the distribution of occlusal forces. When you bite, force is applied to the teeth. What reaction will occur when the teeth are upright and when there is a curve? If there is a curve, the posterior teeth may fall more anxiously or more lingually and mesally. The third is the posterior disclusion. The mandible must be able to move freely. In the case of the deep curve of Spee, interferences are more likely to occur in the posterior tooth when the mandible moves forward. At this time, the mandible cannot move forward. And other problems such as the joint problems may occur due to interference. Therefore, in cases with deep curve of Spee, the mandible is not easily moved because the contact surface of the posterior teeth increases. In figures A and B, there is a difference between the condylar eminence and cant of the posterior occlusal plane. In other words, the slope of figure A is large, and the slope of figure B is almost parallel. This means that the occlusal contact surface in figure B is greater than in figure A. Keller said that in the case of patients with temporomandibular joint disease, when evaluating the inclination of eminence and POP, the small angle is more likely to cause TMD. In other words, he mentioned that malocclusion as shown in figure C is highly likely to cause joint problems. However, in case of B, the mandible can move freely forward, so it is said that it is in better condition than C. Let's look at the lateral movement. For lateral movement, the maxillary canine as the working side, and the lingual and buccal cusps of the posterior tooth, which are the balancing side, must be in harmony. However, if for some reason the curve of Wilson is severe, the palatal cusp of the maxillary is located below the buccal cusp. Therefore, even if the inclination of the maxillary canine is the same, it is difficult to transfer the posterior tooth in the case of severe curve of Wilson. That is because there is a high possibility of interferences due to the extruded palatal cusp. Hanashima said that the occlusal plane plays an important role when moving the mandible forward or backward. Therefore, it is said that the inclination of the occlusal plane should be measured accurately and carefully. Fourth, the occlusal plane is closely related to the position of the mandible. Tanaka and Sato evaluated that in about 100 patients, the inclination of the posterior occlusal plane of the maxilla was closely related to the position of the mandible. Therefore, it was suggested that malocclusion should consider a more comprehensive etiological approach, based on differences in maxillary POP inclination. The same is true of mydhesis. When the occlusal planes such as AOP, POP, and GOP were evaluated, there was no significant difference between AOP and GOP, and POP was steep in Class 2 and flat in Class 3. Steep POP means larger value than normal POP. And flat POP means smaller value. Professor Sater measured POP in the maxilla. However, I measured POP in the mandible. The values are about the same. We have been taught that it is because of the leeway space that the Class 1 occlusion in the process of growing up. However, in my thesis, not only the leeway space, but more importantly, the vertical dimension must be increased and the POP inclination is changed, resulting in Class 1 occlusion. Therefore, when we perform malocclusion treatment, if the vertical dimension and POP inclination are adjusted incorrectly, malocclusion treatment may be difficult. Let's evaluate the occlusal plane and the midline displacement together. In this patient, the mandible has been displaced to the right. At this point, let's look at the curve of SPI and POP on the left and right. Curve of SPI and midline deviation case are closely related. If you look at the left and right side of the patient with a deviated midline, you can see that the vertical distance on the left is longer. Therefore, the MEAW analysis is based on the concept that the anteroposterior position can be changed according to the vertical height of the left and right. And the vertical height can lead to Class 2 malocclusion, Class 3 malocclusion, and midline deviation case. This kind of vertical disharmony can also be evaluated by POP. Let's look at this patient. What is the mesial inclination of the left and right mandibular molars? Will it be the same? Would it be different? You can see that the right side is more mesially inclined than the left side. So, in which direction was the midline shifted? The midline was displaced to the right, where the mesial angulation was severe. At this time, the left and right ramus heights are also different. Let's see this on the model. If you evaluate the curve of SPI on the left and right after matching the midline on the model, you will see a relatively flat curve on the left. But the curve of SPI on the right is severe. The canine relationship is full Class 2 on the right and half Class 2 on the left. At this time, the mandible may also be deviated to the right. Let's look at a paper that evaluates the midline displacement and occlusal plane together. There was no difference between left and right between the anterior and maxillary occlusal planes. But there was a difference between the left and right in the posterior occlusal plane. In other words, the occlusal plane value on the shift side was larger, and this was referred to as steep POP. This occlusal plane also affects aesthetics. In particular, the maxillary incisor position is closely related to the aesthetics. The maxillary incisors must be located 3 mm below the upper lip. In the case of deep bite, the maxillary incisors are more over eruption, which can be viewed as steep UOP. On the other hand, in the case of open bite, the maxillary anterior teeth are under eruption, which can be called flat UOP. Therefore, when evaluating the occlusal plane and malocclusion, remember that Class 2 is steep POP, Class 3 is flat POP, deep bite is steep UOP, and open bite is flat UOP. The sixth item is that a change in the occlusal plane can cause a change in the dental occlusion. This is a paper published in 1997 by Braun. When the occlusal plane is rotated downward and backward, it is said to be steepened. And it is said that Class 2 malocclusion can become Class 1 and can be obtained mainly through Class 2 elastics. On the contrary, it is said that the case where the front part rises upward is flattened. It is said that the case of Class 3 malocclusion is changed to Class 1, which can be obtained through Class 3 elastic. Here Braun studied something important. When the occlusal plane is changed, it is said that a change in the occlusal plane of 1 degree can cause a change in the occlusal relationship by 0.5 mm in the molar relationship. In other words, in order to improve the occlusal relationship of 3 mm, the occlusal plane must be changed by 6 degrees. If you change the help Class 2 relationship with 3 mm difference by 6 degrees, the occlusal relationship can be improved. The seventh is the picture from Dr. Enlow. In normal growth, the maxilla and mandible grow forward. The maxillary posterior teeth become overrupted, and the mandible moves posteriorly. At this time, the compensation occurs in our body. In the case of an open bite, some patients' maxillary incisors may be over-eruption to compensate. In another patient, the mandibular anterior teeth may be over-eruption. Therefore, according to the extrusion and intrusion of the anterior teeth, the extrusion and intrusion of the posterior teeth, or the mesial angulation of the posterior teeth, the patients have various compensation effects. However, in the case of open bite patients, it can be said that the compensation capacity is relatively small. We also need to study more about these kinds of various compensations. So far, I have explained why the occlusal plane is important in 7 categories. If there is an excessive curve of SPI, the chewing efficiency increases. However, it is not good for force distribution or disclusion, and interferences are more likely to occur in the posterior teeth. Since this occlusal plane affects the anteroposterior position of the mandible, it is also related to Class 2 malocclusion and Class 3 malocclusion. This occlusal plane is also associated with aesthetics as it affects the position of the maxillary anterior teeth. At this time, a change in the occlusal plane may cause a change in the dental-occlusal relationship. Therefore, a change in the occlusal plane of 1 degree can improve the occlusal relationship by 0.5 mm. Last but not least, even if the patient's skeletal and dental dentition look similar, each individual has different skeletal and dental problems. So it is necessary to analyze them well and perform customized orthodontic treatment. I will explain this in detail next time. Thank you for watching.